Hi there. Pressure wounds in diabetic patients are the number one cause of amputation. Let's talk about what exactly happens. So, a pressure wound is exactly what it sounds like. It's a wound that occurs due to the fact that there is pressure pushing down on the skin, and the blood is constricted, and therefore the skin tissue starts to die off. It doesn't have enough blood supply. Why does this happen in particular in diabetic patients? Well, diabetic patients have high glucose levels in their blood. And because of that, that constricts, it thickens up the blood, it constricts the amount of blood that gets to the skin, and therefore it starts to get constricted and die off. But even more importantly, is that diabetics don't feel the wound forming. They have a constriction of blood to the nerves in their legs or in their arms as well. And because they don't have enough feeling into the nerves, they can't feel the wound forming as well. So they don't know to move around. If you and I, or a non diabetic patient, has a wound, you're not going to sleep on it very much because it's going to hurt each time the pressure gets put on. Diabetic patients don't feel that. Therefore, what ends up happening is the wound gets bigger if it's not treated. The most important thing, though, is that the wound is sterile and make sure that there is no infection forming whatsoever. As soon as there is even a hint that an infection is forming, redness or swelling or a fever, then antibiotics need to be started immediately, and a culture of that wound needs to happen as well. A lot of times, though, what happens is nursing homes and wound care specialists, they just don't look at the infection part of the wound, and they keep just trying to fix it up and trying to make it smaller by cutting away at the dead skin and putting on gauze, so on and so forth. And when the infection is forgotten about and not actually diagnosed and treated, then it really makes the wound blow up in size. We have a case where there's one gentleman who had a wound that was very small, probably size of a quarter, and then all of a sudden blew up to the size of a dollar bill almost overnight, mainly because of an infection. And it was failed to have been seen or caught and not treated. And he ended up having to lose his leg because of that infection. And that's exactly what might happen if an infection is not actually treated and seen quickly and treated, then it can blow up and it gets to the point where the wound is so big, there's nothing to do but amputation. If you or a loved one suffered from an amputation and you believe that it was due to a wound that had an infection, but it wasn't actually diagnosed or treated, then you may have a medical malpractice claim, and you should really look into that. You should talk to a medical malpractice lawyer. My name is Adam Funk. I am a medical malpractice lawyer. I'd be happy to chat with you about your case.